Hey everyone, this is Dr. Kevin Storm over at Storm Chiropractic Clinic. Today I just want to discuss with you about hip complaints. We see a lot of patients that come in with hip complaints, and we're trying to finish through our extremity cases. So we have gone through the upper extremity and we're going to start with the lower extremity with the hip. And it's really important to make sure that you're going to a chiropractor, going to a healthcare professional to get properly diagnosed, because you need to know, is it coming from the hip? Is it coming from the back? Is it coming from a combination? Is it related to the bone? Is it related to muscles or ligaments or tendons? And they're going to be able to correctly diagnose you so that we can take that course of treatment for you. So today what I want to cover with the hip is just some exercises that you can do at home. Now, if you're having any sharp pain, if you're having any numbness or referral pain, make sure to back off of those exercises and call your healthcare professional before doing any of these exercises. Really important to make sure that they know what you're doing with those exercises. So first one I like to teach, just to really stretch the front and the side. It's really important that we incorporate movement into our stretches, because we are moving throughout the day. We can't just do a static stretch and expect to get a lot of benefit through there. So we need to be dynamic with that. So the first one, you would do this on both sides, but just to demonstrate, I'm gonna have my left leg down. I'm going to bring my right knee, bend here, nice and tall. I'm going to lean forward like a lunge just to feel that stretch in the front of the hip. Now with that, that's a great stretch that you can hold that one if you want. If you feel comfortable and you don't have too much low back complaint, you can add motion where you're extending and flexing, really moving through that hip as more than just your low back. You can also do side to side bending. And you can do rotation. If any of that's painful going through the motion, you can even just hold that position. That way you're feeling the stretch not only in the front, but maybe in the side of the hip as well. So another thing that is more of a static hold is the pigeon pose. So with that, you bring one leg in front. So the same thing I'm demonstrating with the left, but you can do both sides. And what you're gonna do is just lean back. And when you lean back, feeling the stretch through the hip itself, is going to come around to the side of the hip. You can come down to your forearms. If you need a little bit of a deeper stretch, you can always bring your arms out further as well. So either one of those is comfortable. If that's too much, you can even come up and just have your hands down, elbows extended. Those are good 10-15 second holds, both on the hip flexor and the pigeon pose. And then a simple one too would just be your hamstring stretch. It's really important to make sure that we're stretching our hamstrings, attaching from the hip down to the knee. So with that, you can do a static hold, and you can just bring your toes up, lean forward at the waist, feel that stretch there. You can bring your toes in, feel a little bit of a different stretch on the hamstring compartment, and then as well going out. And each one of those, you're bending at the waist, holding for about 10 seconds. Now with that, you can even add motion. So light bending and flexing, as well as slight rotation, just to feel a little bit of a different stretch through the hip. So multiple exercises. Like we said, make sure that your healthcare professional knows what you're doing before you attempt these. Feel free to ask us any questions on our Facebook page, as well as emailing us. Check us out at stormchiroclinic.com to learn more. Thanks, and have a great day.